So today we're here with my beautiful patient Elizabeth. She's one of my best patients that we have, but she has not had any lip filler previously. So we're going to do a little consultation first, and we're going to talk about her goals and what she's looking for to get out of her lip filler treatment. And it's her first time, so I always like to tell all my patients that we're going to be super conservative the first time that we do lip filler, because we like to build them slowly over time. All right, so talk to me about your lips. What are your goals? What are the things you're looking about getting out of today's session?
So my top lip is a little asymmetrical, and I'm looking to balance it out.
Okay, yeah, you have beautiful lips. Your bottom lip is a great size, but I agree. I feel like there's a little bit of asymmetry in your top lip, and that's definitely something we can address today with your first session.
Okay.
Sometimes people think that they can, reach their goals with one lip filler session, but usually I like to break it up into a few of them just to build them slowly over time and just make sure we don't just shove a bunch of filler in and then say, all right, see you in 6 months.
Okay.
I really like to take a slower approach. I feel like they'll stay more natural, you'll feel like you, and you won't feel like you leave with these lips that, are too big or too voluminous or, and not feeling like yourself. So
Okay.
I think starting slow is the best way to go when it comes to lip filler and doing it slowly over time. So we keep them looking natural. Does that sound good?
Yeah, sounds good.
Awesome. All right, so I feel like looking at you, your top right is a little teeny bit higher than your left side. And I like this side. Do you agree? Do you like that side?
Yeah, I agree.
So maybe just bringing up with a little bit of filler here just to kind of even you out. Give you a tiny bit of volume.
Okay.
But we'll start with that, and then we'll let it heal for the next 4 to 6 weeks, and then we can always bring you back for a follow-up.
Okay.
And, if we need to add a little bit more, we can always add a little bit more.
Okay.
Does that sound like a plan?
Yeah, it sounds like a plan.
Awesome. All right, we're going to get some numbing cream on her, let her hang for a little bit, and then we'll get started.
Okay.
Ready?
Yeah.
Cool. Okay, so I want to talk to you because this is your first time, so you're probably not familiar with the different types of lip filler that we have. There's so many out there. You've probably heard of Juvederm and Restylane. Have you heard of those two types of filler before? Since it's your first time, I want to use a product that I think is going to integrate really beautifully into your lip tissue. It's really soft. It mimics your natural lips, so it's going to look super natural. The product's called Restylane Kiss, and it's meant for lips, and it's one of my favorite lip fillers. It lasts anywhere, especially the first time. I tell people that your lip filler is going to metabolize the fastest, and this is something that once you continue to do, you can start spreading out your lip sessions. So the first time, since we're doing a mini lip plump on you, I probably want to see you back in about 3 to 6 months. You'll know when you look in the mirror if you feel like, they're already starting to deflate. I think it's time for me to go back and add a teeny bit more. But this product's going to integrate really nice into your lip tissue and just help with that symmetry. And then with Kiss, we can honestly always change it up, but I feel like this is a great place to start.
Okay.
Sound good?
Yeah, sounds
awesome.
good.
All right, cool. Okay, so the body of your lip is pretty much complete. But what I want to do now is I have a tiny bit of filler left over. So what I'm thinking is I'm going to give you a little bit of support around the corners of your mouth. And what that's going to do is it's just going to help give a little bit of structure to the skin around the lips. And your lip filler will actually look better if we kind of build the foundation of the collagen around the skin here. And some people think, why are you putting filler around my lips? I want it in the body of my lips. But they might not even realize that they're starting to have that collagen loss. And even though you're young and beautiful, it's just good to pop a little bit in now to prevent it, so that if we continue to do lip filler over time, you don't have that ducky look, or your lips are not just going outwards. We kind of really just want to make sure everything stays in proportion, and adding a little bit of support around the lips is going to give you that. Sound like a plan? Mm-hmm. Cool. All right, you're all set. Are you ready to see your new lips?
Yes.
Okay, check them out. How do you feel?
I feel good.
You feel good?
Mm-hmm.
So, they're swollen already, and I know it's your first time. So just keep in mind that the swelling is going to be actually a little bit worse tomorrow. But every day after that, it's going to resolve. And eventually in the next 2 weeks, they're going to be completely back down to the size that they're going to be. And at that point, a lot of people think, I need more filler, my filler's gone. But they start to get used to the swelling. So that's just something I tell my first time lip filler patients to watch out for. Lumps and bumps in the tissue is normal. So if you feel them over the next week or two, they usually go away on their own. If they don't, you let me know and I take care of it, but it's normal. So what I'm going to want you to do is ice them. I'm going to give you an ice pack to take home with you for the next 24 hours. Whenever you feel sore, the numbing will probably wear off in the next hour or two, and that's when you can eat again. But I just want you to make sure that you don't drink out of any straws. No heavy exercise or heavy lifting for the next 24 hours. But icing is going to be your best friend. And then you don't need to massage them or anything like that. I want you to keep them hydrated. I'm going to give you a little Aquaphor lip mask to take home with you. And you can just keep putting that on all day today and tonight before you go to bed. But no lipstick or old lip glosses or lip liner. Just keep makeup off for the next 24 hours while they heal.
Okay.
All right?
Yeah.
And then we can always schedule a follow-up in a month to bring you back. And if we need to make any adjustments or you want to do a little bit more, which I know sounds a little crazy right now because they're big, but you're already swollen from the topical numbing and then from me poking you so many times. So as long as you can look past the size right now and you're happy with the shape, we can kind of go from there. All right, sound good?
Yeah, sounds
You did
good.
great. Awesome. I love them. I want you to take this with you. Okay, this is your lip filler journey, what to expect. So day 1, day 2, they're so swollen. So tomorrow morning when you wake up, they are going to be the most swollen. Not to panic. Day 3 to 4, sometimes the bruising presents at that point. Usually I can tell if someone's going to bruise in the chair. I don't think you're going to, but I don't want to rule that out completely. Day 5 through 7, hang on. These are really nice because once the swelling starts to go down, you start to get used to them. Week 1 to 2, yes, pass me the lippy stick. I love my new lips. And then week 2 onwards, I miss the swelling. It's time for me to book new filler. More filler. So it's kind of an emotional roller coaster, the lip peeling process, but like I said, we'll schedule a follow-up before you leave, but I want you to take that with you just so you know what to expect.
Okay.
And then here's your little lip gloss. I want you to take that with you. That's your aftercare.
Thank you.
And then here is your cute little lip ice pack. So you're just going to gently roll the ice pack onto your lips. Just don't press super firmly. Once this gets warm, pop it back in the freezer, and then ice them as much as you feel like doing today.
Okay.
All right.
Yeah, that sounds good. Thank you.
All right. You're so welcome. New lippies, new you. You look great.
I'm excited.
Good.